Hi, I'm Kim McCarl, the Communications Officer for Contra Costa Health Services. Our department has been fielding many questions since we announced the extension of the shelter-in-place through the end of May. I'm here with Dr. Chris Farnitano, who's the health officer for Contra Costa County, to talk about a variety of topics that people have been asking about. We heard recently from the governor his ideas around a slow rollout of phase 2, and we're still waiting on additional details on what that will look like. But let's talk a little bit about what that means to Contra Costa County. Will we follow the lead of the governor?
Well, the health officers from across the Bay Area will be looking at that order when the actual details do get released. We did just update our stay-at-home order on May 3rd to allow several more areas of activity, including construction and outdoor work. And we really need to look at the effect of those changes over the next few weeks. We have a series of metrics that we are following, and if those metrics continue to show considerable progress, then we could consider making some further amendments to our stay-at-home order even before the May 31st deadline for the current order.
So we know that this shelter-in-place, shelter-at-home, is a hard ask of people. It's a tough thing for people to do. Why did we pick 4 weeks?
Well, it is difficult, and I know everyone is really anxious to get back to a more normal type of life. But we chose 4 weeks because when we make a change and when there's more activity, there's more social interaction going on in work-related activities or people going to different types of retail, we will potentially see more infections, but we won't see those infections right away. It can take up to a week for people to develop symptoms. It can take another week before people get sick enough to get into a hospital and require hospital care. And one of the key metrics we're looking at is the number of hospital cases of COVID-19. And it may take several weeks before we really see a big change in that number. So that's why we chose 4 weeks as a good time frame where if we see continued flattening or dropping in the hospital numbers, that's a good sign that we're not seeing a new surge in infections in the county.
Is it possible we could loosen restrictions in the meantime?
It's quite possible if we see continued progress in all of our metrics, including a steady decrease in the number of cases as well as the number of patients with COVID-19 in area hospitals, that we could see a change in loosening even sooner than 4 weeks.
We're getting requests from some kinds of businesses for exemptions to the order. Are we giving exemptions?
We're not giving exemptions to the order. We are working to help the public understand the order, and we're working with our call center and developing frequently asked questions on our website to help people better understand what the order means for them and what the order potentially means for their business.
We want to thank Dr. Farnitano for being here today to help us understand these questions. There's a huge amount of information available on our website at cchealth.org, and we update it constantly. We really encourage you to spend some time there looking at our frequently asked questions, and then also to let us know what questions you have so we can do a better job of making sure that whatever information you need is included on our website.